Hi, my name's Greg Fell. I'm Director of Public Health Sheffield. This is a piece video on the testing strategy, and I'm going to preface that by putting testing into the context of everything else. So we have a strategy for managing this pandemic in Sheffield set by the Council Cabinet, and it's really simple. There are three aims. 1, keeping people safe. 2, protecting the vulnerable. 3, reopening Sheffield. That's been the strategy right from the very outset, from probably February. There's an operational plan. It's known as the Outbreak Control Plan, and the links to it we'll put at the end of the video if you want to see it. And again, that's remained largely intact for quite some months now. The plan is focused on where the evidence tells us we can make most difference. Prevention, messaging, comms, our approach to mass gathering, our approach to enforcement, both hard enforcement and soft enforcement, managing individual incidents so that cases don't become clusters don't become outbreaks don't become uncontrolled outbreaks with very large numbers of people, and significant amounts of my team's time are put into that. Minimising testing delay, so that we've pushed really hard. If you've got symptoms, get a test and get a test quickly. And what we also want is to get a rapid test result. We're pushing quite hard on getting people tested even if they've got mild symptoms. Minimising contact tracing delay and maximising coverage, so that the time from having a positive test results to being contacted by NHS Test and Trace is as short as possible, and the NHS Test and Trace or our local contact tracing team reach everybody who they need to reach as quickly as possible. Optimising isolation. We know that significant numbers of people who've been asked to isolate don't fully isolate, and we're putting in, or have put in, and will continue to put in a range of interventions to support those people. And lastly, focusing on simplifying the messaging. There are thousands and thousands of pages of guidance for both public and for agencies and organisations. No one's read them all, and there are a lot of inconsistencies between them and a lot of interesting nuances. So we focused a lot of time and energy on kind of cutting through some of the confusion and trying to focus on simple messages. So we've got a fairly clear strategy, a fairly clear set of operational responses, and they remain and have remained the response throughout. A lot of scope to improve. We're always looking to improve. There's definitely work to do on improving contact tracing coverage, contact tracing speed, and isolation. Our efforts to help those who are recommended to isolate. We're taking care when we're adding new testing technology into the existing mix, and I shall come back onto that in a minute. The city has done everything we can to support and protect health services so that they can cope with COVID-19, but also continue to deliver routine care as it has done for time immemorial. And the best way to protect the health service is to reduce community transmission. Hence, we're focused on reducing community transmission. We've put a lot of time and energy as a city into continuing undisrupted education for children, both young children right the way through up to university age, and we're working extensively with both universities to maintain the education system, because education is important for children. A huge effort and energy has been put into optimising the economic support packages, both for individuals but also for businesses. There's always improvements that we can make there. We continue to do that. There's definitely improvements that we need to make to ensure that we've got a good regulatory system and good financial system to support businesses who are being asked to operate in a different way. We are implementing enforcement as and where that's necessary. And lastly, there's always things that we can do to improve our comms and clarify the messaging. So on to testing in particular, which has been quite a hot topic in my inbox over the last week or so. The push from government is to implement a new type of test into the existing testing arrangements. It's called a lateral flow test, which is still reliant on a swab, but the swab isn't sent to a lab. It's a point of care test you get reasonably quickly. Where does that fit into our existing infrastructure? And it's important that we're clear about the existing infrastructure. So there are a number of opportunities for those with symptoms to get tested in the city. So local testing centres, there's a regional testing centre, some mobile testing units, home testing. There's a range of opportunities available, and again, the links to that will follow at the end of the video. We've pushed really hard and will continue to push really hard that the most important thing in this space is that those with symptoms, even those with mild symptoms, get tested quickly. That's the most important opportunity to intervene, and then the interventions that follow it, rapid and complete contact tracing and isolation. Getting that chain right is by far the most important thing to focus on when interrupting disease transmission chains. We've put significant effort into organising care home testing, both for residents and for staff, regular weekly testing for staff. It's the Department of Health coordinated programme, and we've played our part in that. No doubt that's made a difference, absolutely has made a difference to transmission within care homes. It hasn't resolved it completely, but it's definitely made a difference. Significant arrangements for sorting out testing in the event of outbreaks, and for testing key workers to keep organisations running. The strategy for testing has been and remains getting people tested in a timely way, being clear with people what that they know where, when, and how they can get tested, addressing barriers that people will address barriers to that, and will come up with messaging to address that. Then there's the new testing technology, the lateral flow tests. So there's a big push on testing those without symptoms, so-called asymptomatic testing, and using lateral flow tests for that. There are 3 or 4 areas, 3 in the main. Firstly, we will soon be using lateral flow kits to test asymptomatically in defined cohorts of people, and I shall come back onto that in just a sec. Secondly, both universities will be seeking to test a number of students by the 2nd of December to allow them to return home safely. That's known as a test and release strategy. And thirdly, there's mass testing, what people will have seen in Liverpool. That's a very interesting pilot, and it's definitely been proven that it's operationally possible to do that mass testing. What we need to be clear of is the extent to which it makes a difference. So on the mass testing thing, we're waiting to see the results of the pilot. It's a really interesting pilot. They're developing some very interesting science, and we'll consider those really quite quickly. So we do have some planners who are working with us to specify the logistics for rolling out asymptomatic testing in defined cohorts. It's quite fiddly, and it's being done at pace. Both in terms of site identification, recce, the data, the systems that need to be in place to support it. The science on this one matters a lot. It really does matter a lot, and I won't dwell on the science here. There's plenty of it on social media, but the science really does matter. The problem is that the tests are not as accurate as a swab that's then sent to a lab. So the potential for false negatives and the potential for false positives, and there are some nuances on either side there. So what we're doing is we're organising how we do lateral flow testing in some very discrete and defined cohorts, but that needs to be put into the context of everything else. The access to the test, how frequently we retest, because testing once really isn't very valuable. The interpretation of the result, getting clarity on the accuracy of the result, the science, the impact on behaviour. There's some significant concerns. If I test negative, I'm okay. Well, you've only tested negative today, you can still pick up the virus tomorrow. So we need to be really clear about that and get our messaging right on that one. And importantly, the public health intervention that follows contact tracing and isolation, that's the thing that really makes a difference. And then making all of that stick together. So that's being done at some considerable pace, actually. I anticipate being able to have workable arrangements in the next couple of weeks. But we won't be implementing anything until that whole system is clear, straight, and the clinical governance arrangements for it are very, very clear, because it is a clinical test, and we need to be sure how the whole chain works, and that we've got good quality arrangement, good quality and clinical governance arrangements on that one. So it's more complex, sadly, than just rolling out a testing regime. We're pushing on it as fast as we can, and I'd anticipate being able to roll asymptomatic testing out in some defined cohorts over the next couple of weeks, but it is subject to us organising the whole programme, not just the testing kit per se.